Hi, my name is Shelby Henson. I'm a student in MUW's RN to BSN program, and I'm going to talk a little bit today about the national opioid crisis. This is a public health emergency that's been going on for several years now. Something I think everyone in healthcare, not in healthcare, just everyone needs to be aware of the problem that's really going on out there today. So to start, I just got some objectives for this presentation. By the end of this presentation, I would like the learner to be able to give 3 signs and symptoms of opioid misuse. Also, by the end of the presentation, I would like the learner to be able to name 3 signs of opioid overdose. And by the end of this presentation, I would like the learner to be able to give 5 recovery options for those in addiction. So let's get started. Just a few statistics about opioid misuse, overdose, just to give us some little facts to begin with. So every day, at least 115 people die from overdose on opioids. Think about that. That's 115 people that mean something to somebody. They're gone because they misused a prescription drug or possibly non-prescription, but most of them start with a prescription. The Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year, including the cost of healthcare, lost productivity, addiction treatment, and criminal justice involvement. I don't know about you, but that is a lot of money that I don't have to pay for that. 40% of all opioid overdose deaths involve a prescription opioid. Well, I mean, what is that saying to you? To me, that's saying we are prescribing entirely too many opiates to our patients. That's something that we need to go to the providers, the ones that are writing prescriptions, and educate them, and also to the ones that are giving them out, and to the patients, and know that these are addictive pills. You know, that this is possibly an addictive substance you're ingesting, just so that they know. So in 2017, the Department of Health and Human Resources declared a public health emergency and announced a 5-point strategy to combat the opioid crisis. This is something that is being recognized all across America as something that needs to be done about it. So how the opioid crisis affects healthcare. The opioid crisis, because of the misuse of opiates, we're raising the price of patients seen in acute settings, outpatient settings. These patients are taking up our beds in the ER, taking up valuable time in our emergency rooms seeking those drugs when they can't get them on the streets. The misuse of opiates can cause shortages across the country in the drugs that we do give in the hospital for those patients in the pain that elicits the use of those kinds of drugs. We recently just had a shortage here on morphine and certain types of Dilaudid. You know, those are really potent narcotics that we give for the pain that these patients have, and whenever people are misusing them, we're giving so many, that's causing a shortage for others that really do need them. So in 2016, the opioid crisis cost the United States almost $95 billion. Again, that is a lot of money that could be going for the recovery, for the treatment. That could be going to the babies that are going in withdrawals from these drugs, from the mamas who took them while they were pregnant. This could go to the loved ones. You know, they're grieving over the ones that have died. I mean, there's so much that this money could have allocated towards, but the opioid crisis took that away. So next, we're going to talk about signs and symptoms of opioid abuse in lay people and as well as healthcare providers. So, in lay people, which this will apply to healthcare providers as well, there are some different signs and symptoms you want to look for in a healthcare provider on top of these things. So you want to look for poor coordination. Are they clumsy? More so than normal? Are they unable to really focus? So if they have a shallow or really slow breathing rate, it's a really big sign. Constipation. We all know as healthcare providers that narcotics cause constipation. So do they complain a lot about how their bowels are moving? Physical agitation, poor decision making, abandoning responsibilities, and lowered motivation. These are all some signs. I mean, this does not mean that everyone who is not motivated to get something done is misusing opiates, but it's a combination of several of these signs and symptoms. And healthcare providers, we want to look for those symptoms, and we also want to look for frequent work absentees, excessive time spent near a drug supply, difficulty recalling instructions, heavy amount of drug wasting. Watch for those nurses or those providers that say, oh, well, this patient didn't want this pill, let me go waste it. Healthcare providers that are insistent on helping others get their injected narcotics. Do you have that? Just don't think of it as this overly friendly, eager person that's going to help. Look for those other signs and symptoms. Some people mean well, some people don't. And look for personality changes. People, that are misusing opiates get really anxious, when they can't get their drugs. They get really agitated. So just watch for those things. So next we're going to talk about signs of an opioid overdose. So you're looking for someone that's unresponsive, that can't wake up, with slow, erratic breathing, no breathing at all. That can be a sign of an opioid overdose. And a slow pulse or no pulse is a sign. Vomiting, and as well as loss of consciousness and constricted pupils. So you just want to look at all of these things. That's what can happen with an opioid overdose. Next, we're going to look at how we as a community can combat this threat. So we want to be knowledgeable about non-addicting pain management options. We want to recognize the signs of opioid misuse, be knowledgeable about recovery options. We want to know how to use opioid reversal agents such as Narcan. And the neat thing is they're trying to make Narcan much more available to the public, to healthcare workers, because the opioid crisis is getting so big. So they've actually come out with an intranasal Narcan that we can spray into a person's system, and it gets to their bloodstream just as quick as the injected. We also want to know local treatment centers that can help with recovery. Those are just some ways that we as a community can come together and as an organization can work together to combat this threat. So some recovery options for opioid misuse is the HEAL program, which we'll talk about that more in just a second. We have drug treatment centers. Some places are completely dedicated to opiates. You just kind of got to know what's local and what's available to you. Psychiatrists, counseling programs, to kind of look at the root of the problem, what was behind the drug addiction. Usually there's an underlying problem there that needs to be worked out. Behavioral health centers. I know several behavioral health centers offer a drug detox program, so that's something really, you need to know what's local and, if they accept patients that have been addicted to drugs. Some behavioral health centers also offer like the methadone treatments. There are methadone and Suboxone clinics. Those are ways for patients to get off of those addictive drugs and kind of taper themselves and be on a more regulated schedule. The Mental Health and Substance Abuse National Helpline, which is 1-800-662-HELP. That's a hotline that anybody can call. It's free. They're able to talk to someone to kind of find out what their resources are if they're looking for help. So I mentioned HEAL. HEAL is helping to end addiction long term. It's the National Institute of Health's aggressive trans-agency effort to speed scientific solutions to stem the national opioid public health crisis. So part of HEAL, they're trying to prevent addiction through long-term enhanced pain management. And they also want to look into improved treatments for opioid misuse disorder and addiction. They're the ones that are putting so much funding and money behind drug research into different medicines that don't cause the same addiction as opiates do. They're doing a lot of really good work. And so lastly, how can I make a difference? I can make a difference by educating my patients on non-opioid pain relief. I can be vigilant in my workplace, looking for others that may be misusing opiates. I can report suspicious activity when it's warranted. I can be on the lookout for those that are excessively wasting narcotics, who come to work late or who seem impaired when they're at work. I can be on the lookout for that. I can be encouraging when encountering those that seek treatment for addiction. And I can offer non-pharmacological pain relief first before giving narcotic pain medicine to a patient. It all starts with me. I can make the difference. Thank you.